So let's turn to what a further round of those big spending cuts later this year might mean. Now, by far the biggest and most vulnerable spending target, as we were just hearing, is in welfare. We've talked on the show before about the importance of getting the ballooning sickness benefit bill down. But what about the welfare bill more generally? I think it is time for a reality check. So let's talk to Sir Michael Marmot, the Professor of Epidemiology, who has become this country's prime expert on welfare and poverty. Sir Michael, very good to have you back on the show. How would you regard the prospect of further cuts to the welfare budget coming later this year?
With alarm. With alarm. It was very clear over the last 14, 15 years that health has stagnated and people's economic fortunes had stagnated at the same time. If you look at what happened to real incomes, they really didn't improve over a period of 15 years. And not only that, but because of the big inequalities in income, the income of richer people, they were doing fine, but poorer people, not at all. And that had damaging impact on health. Now, when you think about the impact on health of income, a lot depends on what else is provided. If you've got good health care, free at the point of use, if transport is affordable, if nutritious food is affordable, if rent is affordable, then the impact of low income on people is less. But for example, if you look at people below the median, so middle and low income, if they are in private rental, they are paying 40% of their income on rent. Wow. And to eat healthily, people in the bottom 20% would have to pay 50% of their household income on food. If they're paying 40% on rent and 50% on food, my goodness, they're in a mess. So the fact that we've got low incomes is partly because people are lowly paid, and partly because welfare, if people are on benefits, they don't get enough money to live a healthy life.
And we both know that the benefits bill is the obvious and in some sense the easiest target for the Treasury to go for. So when you hear Keir Starmer use a word like ruthless when it comes to spending cuts, that's not a very happy word to hear, is it?
It's not a happy word to hear. I mean, I agree with what Jonathan Ashworth said, that work is a better option than being on benefits. No question about that. But people on benefits, people on universal credit get about 70% of what they need to meet the essentials of housing, heat, light, food, clothing, toiletries. They get about 70%. Now, if you haven't got enough to meet your essential needs, your health will suffer physically and psychologically. I mean, it's really, really stressful to be poor.
Yeah, it certainly is. This is sorry to jump in, Michael, but this is a government which says it's a government of growth, and, that's fine. But the Labour Party was also the party of fairness. So what would your message be to Labour MPs who might be confronted with big welfare cuts this spring?
I mean, there's a longer-term issue. I've just been looking. People like me used to say, oh, we're a rich country. We've got the 6th biggest GDP. We ought to be able to do these things. I've just been looking at the figures of gross domestic product per person, and we rank 29th. We're not the 6th richest. We're the 29th richest, and that's average. And we've got bigger inequalities than all other European countries, so that our poor people are really poor. Okay, they're something like 25% poorer than the bottom 10% in France, Germany, the Netherlands. Our poor people are really poor. We can't do anything to make their circumstances worse. Their health will suffer. So don't use terms like ruthless cuts if that means making poor people poorer.
And don't go back to austerity, the latest version, in the same way.
absolutely don't go back to austerity, because we calculated over the period from 2010 to 2020, because health follows a social gradient, the poorer you are, the higher the mortality. There was something like 1 million excess deaths linked to deprivation. And of that 1 million, 148,000 were more than there would have been in the decade before 2010. In other words, it looks like austerity killed 148,000 people. Please don't go back to austerity.
Well, there is a very solemn, indeed horrific note to end on. Michael Marmot, thank you very much indeed for talking to me tonight.